Thank you for joining us for this week's Mayor's Brief. With me, I have Stacy Jesso. Stacy works with the UNC Nash Hospital Systems Foundation. Welcome.
Thank you. It's great to be here.
Yeah, tell us a little bit about what you do and what the foundation does for Rocky Mount, for the hospital. And, I think a lot of people out there have probably seen your name, have probably even been touched and asked for a few shekels. But there are a lot of people out there that probably have no idea what you really do and what it means to the area.
Great. Well, so I've been here about almost 8 years in July, and I was recruited by Nash to come and run their foundation. So I'm actually the Chief Development Officer for Nash UNC Healthcare. And so a part of my role is to really run the foundation. And so we're the charitable arm of Nash Healthcare. And so we are the fundraisers, we're the community connectors. And so we work in conjunction with them and really help them to raise money around their strategic direction.
Okay, so can you tell us a little bit about the strategic direction that you're currently headed in?
Sure.
And that you believe that will minister, I guess, to our community ultimately?
Sure. So two things that really pop into my mind is our cardiovascular program. Mm-hmm. So we are great partners with UNC Cardiology, and we have really elevated that program. We have a beautiful, beautiful heart center, and also our cath lab is one of the state-of-the-art in the region. And so another part of our direction is really our cancer program.
Okay.
And that's the UNC Cancer Care at Nash. And we just recently, well, I say recently, it was almost 2 years ago, a year and a half ago, we opened the Danny Talbert Cancer Center.
Sure.
And so those two, there are many things that we do, but those two are probably the two that the foundation really gravitate to.
Okay.
We were instrumental in a number of years ago raising money to support the initiative around building a new emergency department. And so the foundation raised almost $3 million to do the pediatric emergency department. So we do a lot of things around not only the bricks and mortar piece, which we're actually kind of getting away from the bricks and mortar, and really focusing on the project and program development.
Sure, and I want to come back and talk about that a little bit later. It feels like yesterday, although I know it's been at least 8 or so years, that UNC came into the lives of those of us who formerly knew it as National Hospital. So as I understand it, National Hospital is a county-owned entity controlled by its own board, and we have contracted management services through the UNC hospital system. And so in that role, the management company is providing direction and vision for our hospital as we're moving forward, and has provided us access to probably far more resources than we would have had on our own. You want to speak to that a little bit, because you touched on the Cancer Center, you touched on cardiovascular, and those are two programs that traditionally, if you experience those here, you either went to Raleigh or you went to Chapel Hill for. And that's really a great thing, a great service to have here locally.
Right. So yes, I think I'm trying to think of how many years. It's probably been about 6 years that we've had the management agreement with UNC. I was fortunate enough to be a part of that as a part of the executive team, where we interviewed several large healthcare systems to see who was going to be the perfect match for us here in Rocky Mount, the region, and Eastern North Carolina. So I think the one thing good about UNC is that it was actually new to them. So, it's certainly new to us, and it was new to them. So we've actually been a part really from the beginning as they have begun to move out around the state. And so they have been very beneficial to us. And it's like you said, I want folks to understand that we still control our assets, that we still have a governing hospital commissioning board, and Nash County. But the good thing is that we're able to partner with UNC around a lot of initiatives. One of those, I think, is really our physician recruitment. So when I came here, almost 8 years ago, what we found in the community was we were having a difficult time really getting physicians to relocate here in Rocky Mount. And so with the UNC partnership, it's really helped us be able to tap into their resources, because a lot of physicians really want to practice community medicine. They don't want to really work in Chapel Hill or Raleigh or anywhere else. They want to live right here in our community. And so, but they also have a tie to an academic medical center. Okay. So it's really been a great partnership for us. And so we've really, Dr. Isley, who is our CEO, I think has done an amazing job with working with the physicians group and bringing physicians here. And there's a part of that strategy is that we are really trying to recruit other folks.
So you were talking a little bit about sticks and bricks, trying to move away from that,
right?
From a hospital perspective, also from a development perspective. So tell us a little bit about that. What does that mean? Are we looking at telehealth services? Is the focus on at services provided in the home? What does that mean?
So when I first got here, we were very focused on the bricks and mortar piece. Right. And I think traditionally, kind of old school, that's how donors kind of gravitate to you. They understand the bricks and mortar.
Put my name on it.
Right, put my name on it. I can see it go up. I can see the building. I feel like my money is actually going to support something I can see. And so, I had a great board. But the board was having a difficult time. I'm used to more programmatic needs. We were getting away from the bricks and mortar in the Charlotte area. And so I was trying to talk to the board about how important it is to have really outstanding facilities, but it's just a building. And so what really goes into that building is really the heart of your program. And so some of my board members couldn't understand. They couldn't put their arms around, well, how does it look to how do you support a program? I mean, what does that mean? And so as we started to work together through a strategic direction, this was probably in 2014, 2015 when we started with the foundation, looking at how we could be great partners with the hospital and really leverage the community in feeling good about the investment they were making for the hospital. What I hear a lot, and it's not just here, it was when I worked at Novant too, is that folks don't necessarily want to give money to, as you said, the hospital, because they don't really know what that means. They say, what's going to happen to it? Is it just going to, sit in a big fund or, whereas with a foundation, you know that you have certain funds set up and those funds are being managed ongoing so that they are actually being dispersed and being used in the intent that they were given. And so what we started to find, particularly with our cancer program, our cardiovascular program, and really throughout our hospital, is really the needs of our patients. I mean, our number one priority and focus is really the care and the health of our community. And that's in the forefront of all of our minds. And so what we started to see with a lot of our patients was, healthcare is very expensive now. Mm-hmm. And so as folks are going through their cancer treatment, I'll use that as an example, they may have other challenges around financial hardships. And what that might be is a cancer patient who is coming in for radiation. That patient may come in every single day, 5 days a week for 6, 8, a long time. And it may only be a 10-minute visit for the radiation treatment. So think about, I think about myself or a family member where they're having to drive to Chapel Hill or they're having to drive to Duke, to Durham, to Raleigh even, for a 10-minute treatment of radiation. And so what we were seeing was now our partnership with UNC, not that we couldn't do this before, but we have a lot more capability now with UNC because folks who maybe are diagnosed or begin their treatment with big UNC, our physicians there are now saying, now you can just have your treatment done right there in Rocky Mount. So people are going 5 minutes, to our cancer center versus driving to Chapel Hill. But what we saw with folks was, of course, the underinsured, the uninsured. We wanted to make sure that everybody, got the care that they needed. And so we created patient assistance funds. And it was really helping those patients maybe offset some medicine co-pays or getting medicine that they couldn't get. It's paying for some utilities because most of these patients are not working as they're going through their treatment. So we wanted to make sure they had gas or transportation to and from their treatments. So, or getting their power bill paid, and it's just a little extra help for these folks.
Oh, no, look, it's significant. Both of my parents have had cancer bouts. One passed away with prostate cancer that metastasized, and going through the chemotherapy and the radiation and having to make the trip that you talk about. And my mother with breast cancer, where the treatments were far more frequent, even for a 2-hour or 3-hour stay, the patient's tired. In our case, we had a great support system. I've got plenty of sisters who live close by, close enough by, to be able to provide that support, cousins who are willing, and so on and so forth. But if you don't have that, that's a very difficult challenge for folks to overcome on a daily basis or during that period of time, that spell of illness. So one of the things that people I don't think really fully appreciate is that you look at hospitals and they are large economic drivers in their community. They hire lots of people. The median incomes are substantially larger than they are in many other industries, primarily related to skill. There are reimbursements. But the charter requires that you take every single patient that walks in the door. You don't really have the ability to say no. So what is that as a percentage at the Nash UNC system? Because that's a large part what you've just described is really what's driving the current needs, what your current position and funding is. And then I want to talk to you about, raising money in a COVID-19 world, right? So, and I know that that's got to be somewhat of a challenge. But let's just start with what the need is, because I think a lot of people need to understand that.
Right. I don't know the percentage. I mean, I probably should know that off the top of my head. What I do know is that we do have a large percentage of our community who live below the poverty level.
Sure.
We also have a large part of our community that have chronic illness. And we also have a large part of our community that don't have access to primary care for whatever reason. And so what we try to tell folks is we encourage them to connect with a primary care physician. Because honestly, coming to the emergency room for sore throat, for just general primary care is the most expensive primary care you can get.
No question. And inconsistent, because you're not seeing the same provider on a daily basis. You don't have your guy or your girl who helps you really navigate through the healthcare system, which is very important.
Exactly. So, for our case managers, really try to work with these patients, because if they come through the emergency room, and these are maybe some of our more acute patients who come in and are admitted, we want to make sure that they're going back home to a safe environment, that they have a home to go to, that they have a caregiver who can take care of them. The other piece is the medication piece, making sure they understand what medicines they're taking and why they're taking them and how to take them. And so they will all work with case managers. But a lot of times, we give them their discharge plans, and I think our group, they really care about our patients. So it is a one-on-one kind of thing, and you lay it all out, but that patient may go home, and who knows what happens when you get home. But they may mess up on their meds, or they can't afford their medications, or they go back to maybe eating some unhealthy foods, and so they end up back with us.
Right.
So I feel like we've spent a lot of time really trying to help those folks. And you're right, we treat every single patient the same that comes through our doors. Because as a community hospital, and any hospital across the country, that's what we're here for. So we don't, there's no judging, there's no saying, insured people go this way, uninsured people go this way. I mean, we care for all of our patients exactly the same.
All right, well, that's great. So we've got these needs. You have got this agenda and this focus to support the hospital and to take care of those who may be less fortunate than the rest of us. And we're in the midst of COVID-19, and you've had to cancel at least, or I shouldn't say cancel, you have postponed 2 fundraisers. So how significant is that in the life of a development officer in a hospital, in a community with a median household income of $38,000? Right. I mean, those are small numbers. Big numbers, small numbers, right?
Right. So I think overall for the hospital, I mean, not that we make light of it, but we say that now one day is like a week, because we are honestly dealing with something that we have never dealt with before, and hopefully none of us, or not me, is going to have to deal with it again in my career. But it's tough, and I can't say enough about our board. I can't say enough about our leadership team and our frontline staff and our leaders who have really they have buckled down. That hospital is running like a well-tuned machine. So, but everything else is, life as we knew it, 6 weeks ago in the life of a healthcare worker has totally changed.
Isn't that amazing? 6 weeks ago.
I know.
6 weeks ago. 7 weeks ago, Duke played Carolina at Cameron. And I was talking to a friend of mine. He said, that was my last social outing for,
right.
Well, what feels like a lifetime now.
Right.
But that's not been long ago. But good gracious, it feels like a small eternity.
Right. So for us, from a day-to-day basis, it's been really hard.
Right.
And not only that, we're not only just focusing on our patients, but we're focusing on our employees. Because our employees are challenged and face just unbelievable hurdles every single day.
Very, very, very few have been infected at the hospital. A lot of people have come into the hospital, but infection control in that facility has really been done exceptionally well. And I don't think that the hospital's taking credit for that at levels that they should.
Right. So yes, so we have a fantastic infection control. We have a new chief medical officer, Dr. Ann Schreiner, who is here and moved here, who's doing a great job. And honestly, our Dr. Crystal Hayden, who's our chief operating officer and chief nursing officer. We have some stellar folks who are literally on the front line. I'm talking about they're rolling up their sleeves and really working to make sure that all of our boxes are checked.
Well, that's clearly the case because the results are speaking for themselves. But I don't think that the public as a whole necessarily hears that as much as they should, knows that, because that's a big, big deal.
Right. And so, it's like I said, every day changes. Every hour, every day. What we did 2 days ago, we're doing something different today, trying to keep on the pulse of everything. And it's not just our hospital, it's every hospital across the country. And so, one of the things that has been a real struggle for us is really around our PPE, which is our personal protection equipment. Because, getting access to that, like every other hospital across the country, and how can we make sure that we have the mask, the gowns, everything that we need to not only protect our patients, protect our staff, and making sure that everybody that walks in the hospital feels comfortable enough to be able to have their own mask, so that because it is a lot of times it's perception, but now we have gotten to the point where we're able to do that.
Well, look, sick people go to the hospital.
Right.
That means there are a lot of people with a lot of germs and viruses and bacteria. Just by nature, if you're seeking help there, it becomes a target-rich environment that you really don't want to insert yourself in. But that's your point. Folks are doing an outstanding job of making sure that those quality and infection controls are in place.
Yes, exactly.
Yeah.
So, from a financial perspective, this has certainly been it's going to be a tough time for every hospital across the country with the financial implications from COVID that we've already seen some. I'm sure we haven't seen all.
Well, we need to talk about that a little bit. I don't think that many people in the general population recognize that most hospitals really aren't operating at 110, 120%. The staff that are there are trying to treat COVID-19, but a lot of the elective surgeries that typically go on, where knee replacements, hip replacements, that are just a routine part of a hospital's experience, have all been shut down throughout the country. And that's a big part of the revenue stream.
Absolutely.
Plus, it's a big part of what a lot of physicians and nurses do. So, it is kind of counterintuitive when you hear of a large hospital system laying off a number of nurses or employees, yet at the same time you hear about needing more beds and having to try to figure out how we're going to find PPE, how we're going to find all that stuff.
Right.
So anyway, it's just kind of interesting that, again, I don't think a whole lot of folks understand.
Right.
So what do we need to do? How can we help the hospital? How can we help Stacy Jesso on behalf of UNC Hospital?
I have a whole list. Anyway. So what we have really, as I said, we've certainly focused on our patients every day. But something that, I'm working on and working with some of my teammates in the hospital as well as the foundation is really how we can support our employees. And so we've created part of our intranet, we have it set up where our employees can go in and see all the ways we have emotional support for them. And so because they're spending a lot of hours there, they don't have a lot of free time. So the community has really rallied around that. So we have a lot of community restaurants and actually donors who want to bring meals for our healthcare workers, which at first started out where we were getting so much food at once that it was hard to manage. And so now we have kind of a well-oiled machine where I have working with some folks in the hospital where we now have kind of a master spreadsheet, making sure that every department is touched on a rotation. Because I think sometimes the donors say, I want it to be the emergency department, I want it to be whatever. And we want that too. But we also, as I said, our maintenance, our dietary, our environmental services.
A lot of people behind the scenes doing a lot of heavy lifting.
Yes.
Yeah.
So anyway, we have we've set up, myself with contacting the foundation, contacting me, Rich Jared, who is with our wellness. I'm working with him, and he's also fielding some of those calls, and he's put together this master calendar. And so we're plugging people in who want to donate meals themselves. And then, Little Caesars, they have been amazing, but I can't tell you the number of pizzas that show up at our hospital every single day. Papa John's. We've had everywhere from Oak Level Cafe, who last week brought 100 hospitals with all the fixings. We've had Lorema Coffee, Kevin McLaughlin downtown. And what he has done, he has actually asked people who are, picking up coffee and things, if you'd like to make a donation. So they're making a donation to him. They're also making a donation to the foundation. And we pool that money. And so he comes over on the night shift and also on the weekends. And we have what we call a sunshine cart. Okay. And he brings the coffee and some banana bread and all his goodies. And we take that, we round throughout the hospital. And so that's been a huge success. So that's worked really well for us. We have folks who've called that want to do something, but they can't quite figure it out. And so we've created a COVID-19 fund. And so we've asked folks they can donate through the website online, or they can send us a check. And what that does is, they can specify if they want it to be for meals or snacks for the Sunshine Cart, whatever. But a lot of folks are just doing unrestricted gifts. And so what we do is it goes into this COVID-19 fund, and then we're able to use it where it's needed the most. And so I talk about anywhere from our Sunshine Carts, which we go out on, 3 times. We do Monday and Wednesday from at 10, at 3, at 8 p.m. We do the weekends, 2 and 10 p.m. We want to make sure that we're hitting all the shifts for our workers. And churches, from the congregations to anybody has donated so many snacks and everything to us. And so we're filling these sunshine carts. And as I said, we're off and rolling. And also, administration and leaders are actually rounding in the units to be able, it's really an acknowledgement to thank them for the work that they're doing and how much we appreciate that.
That sounds fantastic. It also sounds like a really difficult place to lose weight.
Well, yeah. I told Rich, the wellness department's going to be very busy after this is over.
No doubt, absolutely.
But I did want to say around the general donations, really for COVID, our CFO yesterday in our team meeting has been tracking the PPE and the cost of PPE. And so he announced yesterday, and all of us are flabbergasted, that we spent about $700,000 on PPE over the last 4 weeks, 5 weeks.
Wow.
Where we historically spend $100,000 a year.
Yeah. Wow.
So that is overwhelming.
It is overwhelming. And then when you look at the fact that COVID's going to be with us for some time until a vaccine has been established, we're flattening the curve. We're not making COVID go away. So surely there will be a new norm where universal precautions will require additional PPE, which of course increases the utilization.
Right.
That's going to be with us for a while. Hopefully not at those numbers.
Right. Yeah.
But still, it's not going down anytime soon.
Right. And you mentioned, that our ancillary services, which we're not able to, a lot of them are not open. Our elective surgery is not open. And so for that, we have, staff down, and not necessarily, I don't want to say because of the COVID numbers, but we're actually staffing down because of the volume. So it's not only, that we're not doing that. Our volume is low because people, it's some of the lowest volume we've had in the ED because nobody wants to come to the ED.
Well, I can't say I'm signing up unless I'm really, really, really sick.
Right.
Yeah.
So people are really thinking, twice before they come to the ED.
Right.
Of course, surgeries aren't happening, so we don't have those patients that are admitted. And so on top of what we spend for the COVID, we don't have the generators of funds that we would have on a normal normal day.
And that just seems so counterintuitive in the midst of a pandemic, right?
So.
But I think it's important for folks to understand too.
Right.
All right, so time's come to leave, but is there anything that you want to leave our viewers with?
What I want to say to our viewers is thank you so much. Really, it's been heartwarming for the folks who have contacted us we've had Rocky Mount Academy, children who are out of school doing service projects or doing activities. The teachers have been great about in their weekly packets giving them assignments. They've made us stress balls. They've put together candy packets. So it's heartwarming to me that people, we have them come and chalk thank yous on outside where our workers are coming in and out. And I think our workers really see that too. The things that have been, and nice messages, social media, yesterday in our meeting it talked about how our social media has just gone skyrocketed because, people are at home. But the message that people are sending out, and it really does touch our employees and their families. So we're extremely appreciative of all that everybody has given and invested in our healthcare system.
Well, look, thank you for being here, and thank you for all that you do for us and our community and our healthcare system. Really appreciate you being here.
Thank you.